Doctors, nurses, redditors, what has been your most gory, disgusting or worst medical experience? As a paramedic, responded to a call of traffic accident, baby ejected. We prepared for the worst we could imagine. Arrive in about 8 minutes. Trooper on scene trying to clear the area of bystanders, gawkers and preserve the scene. He had covered the baby with the yellow death sheet troopers carry in their trunks. Lifted the sheet to check vitals, pronounced death. And it was not a baby, but the top half of the 19-year-old girl that was driving the small pickup truck about 50 yards away. She was driving and arguing with her 19-year-old husband who was the passenger. They were doing about 55 miles per hour on a 2-lane road and met an oncoming truck pulling a double-wide mobile home. She ran under the front corner of the mobile home, cutting her in half. Her bottom half remained in the driver's seat, while her unhurt husband watched as the truck skidded another 50-60 yards, sideswiping a minivan, sending it into the ditch upside down. When the truck came to rest, her bottom half fell out onto the ground. We also found a trail of ribs from the cab to the bed, and down the pavement to the top half. It looked like a movie set. Her top and bottom looked unhurt, but from mid-chest to about pelvis was strung along the road. The husband was absolutely freaking out about what he had just seen. He was babbling incoherently, running around swinging at people. Just a mess. A witness who lived right in front of the scene started having chest pains and had to be transported. We took the husband, and I called medical control and actually got orders to give him Valium, something paramedics normally can only give for grand mal seizures. The driver of the big truck was fine, but was also very distraught at what he had just witnessed. That was 16 years ago and I can still remember pulling up to that scene like it was yesterday. Holy crap, that is intense. I used to be a nurse's aide. I once had to put a very obese woman on the bedpan. She was only mid-40s, and I left. She put her call light on and when I answered she said she was all done. I turn her on her side to remove the bedpan only to see that it is empty. My first thought was that she had been mistaken about having pooped. But then I look and realize that her butt cheeks were so massive her entire dump couldn't make it the length of her cheeks and had gotten wedged in between them. I had to dig the entire load out of her as by hand. It was only about 2 months into the job and it gave me some serious second thoughts. Haha. A child came to the hospital with cigarette burns dotting his torso. Almost every patch of skin that could be covered with a t-shirt was scarred. Some of the marks were old, some were very fresh. His parents said it was a skin condition. Oh frick, that is heartbreaking. Autopsy tech death investigator. A morbidly obese man had died in a cheap motel room with the heat cranked up and wasn't found for several days. By the time we got him to the morgue he was horribly bloated from decomp gas and was purple and green all over. There was lots of skin slip. Our forensic pathologist went to make the initial Y incision, and the force of the escaping gas blew gore all over us and the ceiling while making a sound like a wet balloon with the air being pinched out. We all paused for a moment as the worst stank I have ever smelled enveloped the room like something that had crawled out of Satan's anus. Then we burst out laughing because it was all we really could do. It didn't help that he was leaking liquefied fat all over the floor. The crap is slippery. My boots have never been the same since. TLDR. Got hit by boomer gore. In my EMT class an instructor was telling me about one of her calls to a freeway accident. There were 2 cars involved, and one of them had an elderly couple in it. Since she was so small, my instructor is often assigned the job of crawling through the windows of the car to stabilize patients while the crew works on prying the doors open. She crawled into the back seat of the elderly couple's car and held manual C-spine for the woman, holding someone's head in place to prevent an injury by twisting the spinal cord. As she held the head, it came off in her hands. The woman had been decapitated by the accident. She had to take a couple of weeks off after that and talk to a therapist to help cope. I can't imagine what it must have been like to go through something like that. Knew a paramedic who had similar happen to him. They rolled up to an accident in which the top of a car had been sheared off. Being a classic, horrible sense of humor having person, he immediately asked his partner if he wanted some head. ORN here. This, so far, is the only death I've experienced from work that I've lost a significant amount of sleep over. 24-year-old male walks again walks into the ER with complaints of flu-like symptoms for the past 3 days. He had decided to come in that day because he started to develop a rash throughout his body that he was unfamiliar with. Sadly, this rash was actually the result of a failed battle with bacterial meningitis, causing him to bleed internally and externally. By the time we got him back into the ER, he started crying blood and the terror in his eyes was palpable. He went downhill fast. His lucidity diminished with his blood pressure, and the last thing he said before succumbing to pulseless VTAC was something about his mother that we could not make out. You could see his consciousness fade from his eyes as we started compressions. The code lasted close to an hour. At first we could still keep his oxygen levels up with mechanical ventilation, defibrillation, and drugs, but blood was filling his airways faster than it could be suctioned out. He was bleeding too fast for any medications or fluids to keep his blood pressure up. He died soaked in blood and nearly unrecognizable due to his now almost uniformly purple skin and swollen face. We later found out that he was studying neurobiology, had a devoted girlfriend that was for all intents and purposes a fiancée, a large family, and many friends. He was an athlete who lived healthy. He had beautiful curly hair. This made the death tragic in a way that you just don't experience when a 80-plus-year-old dies. It made the unanswered pleads to God for help that had been sent echoing around the room by his family all the more bitter. I helped drag and push him into a body bag. God, that was the worst story. It wasn't even disgusting, just heart-wrenching. I've only been on 2 ride-outs with a medic crew, and that was tough enough, but the feeling of saving someone's life was absolutely the best feeling in the world. I can't imagine what it would be like to watch the spark of youth fade in such a horrible way. My dad has been a nurse for nearly 20 years. He has moved around from working on the ER to radiology and now the ICU. He is one of the most well-respected nurses in the hospital. I would know because I worked at the same place as a phlebotomist. Anyway, our hospital is a bariatric center of excellence, so you know what that entails. Some pretty big patients. So this one day, I go up onto the 4th floor in the neuro unit to get a blood draw, and as soon as I step off the elevator, I smell crap. Really foul, rotten egg smelling crap. I don't think much of it as the hospital is older and is poorly ventilated. I know, right? But when I get home, I ask my dad about it since the ICU is on the same floor. He said that they had a guy who was 550 pounds in the unit, and he was having some abdominal pain. Turns out he hadn't had a BM in almost a month. Before he was transferred to our ICU, other clinics had tried giving him a few enemas to no avail. So my dad is saying that he is putting in one of those balloons into the guy's anus so he can attach a bag, like a catheter. He turns around to check a monitor and he hears this dripping noise behind him. Turns back around, and there is a river of crap falling from the bed. The entire floor is covered in a month's worth of crap, dripping, splashing, all over everything, including my poor dad. He and all the nurses roll up their scrubs like they're going clamming, and after an hour or so get this guy cleaned up. Housekeeping stopped by and just left a card for them and said, nope. I guess right after they finished cleaning it happened again. I don't even want to imagine the smell in that room if it was enough to stink up the whole 4th floor. I can't begin to describe the respect I have for nurses. A few that stand out: a man with no penis, prolapsed rectum, Google image if you dare, debridement of a limb so that smelled so horrible you could smell it from the time you stepped into the A&E, maggot infested wounds, bed sores that were so deep you could see pelvic bone, among other things. This is Reddit. We're very familiar with prolapses. I'm a nursing student. We just finished our first clinical placement at a nursing home. Not me, but my friend did something ridiculously funny. She was dressing a man, and while pulling his pants up down, not sure, he started to do a really big poo. So she put her hand out under his bum and caught it. The other nurse starts laughing her head off at my friend standing there with a huge crap in her hand. She asked her why she didn't just let it fall to the floor, and all she could say was, I panicked. I love nursing school stories. Friend was getting someone off the bedpan and found it completely full. Wouldn't flush when she emptied it, so instead of asking for maintenance, she fisted the pile of crap down the toilet. The worst: anytime you finish washing a patient and changing their sheets when they have very loose bowels and the bed is immediately covered in it again as soon as you're done. GI bleeds are the worst of them all. The smell of congealed blood and fecal matter is not something you forget quickly. Gah. GI bleeds are the nastiest smelling crap ever. I once had a patient with a GI bleed and diff. All the nurses on the floor had to take turns cleaning him up because no one could stomach doing it twice. The very last patient I saw in my internship came in with a cyst in her pubic area. Think to myself, okay, seen plenty of these. No big deal. I walk in to find a cyst the size of a jawbreaker. It was purple and practically had a face. We had to lance it, so we needed to give local anesthetic. When the syringe touched the cyst, the whole thing blew open with pus. The smell in the room was terrible. Upon pushing on it further, the cyst made a sound as it released more pus. It sounded like basketball shoes on a freshly waxed floor. The core of the cyst was about the size of a dime. Love this kind of stuff and considering going into dermatology. This kind of doesn't fit the topic, but kind of does. My mom used to work at a teaching hospital in the perfusion department. This meant students held a pig lab where they would practice their work with pig blood. Now, there's some sort of flushing process that occurs with the blood. I'm not really sure how they dispose of it. Well, construction crews were nearby building a new facility. One of the workers must have hit a pipe, because this blood starts spewing everywhere. My mom gets a frantic call because they thought it was human blood, which would have been much more dangerous. They were told the situation, but I'm sure there were lots of pants crapping around the site that day. My mom gets a frantic call because they thought it was human blood. They probably thought it was like that club from Blade. I saw a man just after he was burned in a boiler explosion. His skin hung in strips off of his body, as if it had slipped off, like how easily the skin of a tomato slips off after it is boiled. Underneath was glistening pink-red flesh. The room smelled of cooked flesh and mechanical grease. The poor man was aware and screamed in pain. It was terrible. I can't believe he lived through a boiler explosion. He was basically being steamed alive. I am not surprised his skin did that. Those things are ridiculous. Family owns a boiler business. I want to tell this story because I feel there is very limited knowledge about when it is appropriate to withdraw care on your family. If any of you take anything away from this, please write a living will and talk to your loved ones about your wishes. A man brought his 92-year-old mom to our hospital because we were renowned for our outcomes. She had some pneumonia and was placed on a ventilator, breathing machine, to help breathe. Numerous antibiotics and drugs were given to help the lady as her son wanted everything done. She stayed on our unit for weeks breathing and eating through tubes with incredibly advanced dementia. Every time we came into the room or spoke to her you could just see the fear in her eyes. Every time we had to turn her vent settings up as she got closer to dying. We talked to the son about withdrawing care. He denied. Never. This was his mom and he did not want to let her go for any reason. He started yelling at the staff and we had to escort him out a few times. Yet since he was appointed as the decision maker in her living will, we had to continue to ask him to make decisions about his mom's care. When his mom was literally days away from death, maxed out on every drug we can give, we asked him to withdraw care on his mom. He punched me in the face. Later that day we performed CPR on his mom, breaking 4 of her ribs and she died anyways. The rest of the family watched us do this in horror to their mom because the son could not withdraw care. When you are appointed to make decisions in a living will, it can only be up to you. We could have withdrawn care weeks earlier, giving her a peaceful and restful death. If we are all going to die eventually, we should have the respectful choice to decide when we no longer wish to be cared after. It is therapeutic. Sometimes, enough is enough. TLDR. Ask your parents what care they want and under what circumstances, and please, fight for that. I work as a paramedic in Canada, more specifically Ontario, and we were dispatched to a call by police for a code 4 emergency, code 5, obviously dead, and requested to bring a box of N95 masks. My partner and I were quite confused but did as we were told. When we arrived on scene, a police officer met us outside and when I handed him the box of masks he looked significantly relieved. My partner asked what was going on and the officer directed us to the door. Within 2 steps of where we were we began to smell it. That oh so obvious smell of death. Death that has had time to fester. At this point we understand the request for masks, and as we poke our heads through the door we are greeted by a clearly deceased human. We are assuming it was a woman who probably weighed on the light side of 400 pounds when she was solid, which at this moment she was not. The officer proceeds to tell us that she hasn't been seen or heard from in 2 weeks, and when someone finally came to check on her, they found her as a puddle. To make matters worse, she had her heat blasting. It was the middle of summer and temperatures can get up to 30+ degrees Celsius or approx 86 degrees Fahrenheit, and she had all her blinds open and she was seated in direct sunlight. It was probably the most disgusting sight I had ever seen. This wasn't so much what had happened but what was said. I worked in a nursing home as an aide and was putting one of my favorite residents to bed for the night, and I go to leave the room. She's on alarms because her dementia is so bad that she thinks she can walk on her own and it goes off. I turn around and help her do what she's getting up to do, and as I'm tucking her in again she stops me and says, "Jeremy," her son name, "you can have the money, just don't beat me. It's not about the money. You can have it, just be a good boy and don't hurt me. TDLR." One of the most horrifying things I have ever seen in the hospital was a guy who OD'd on one of his prescription medications. One of the side effects was priapism, erection lasting more than 4 hours. Once the doctors got his cardiac and respiratory systems relatively stable, they tried to get rid of this poor dude's erection, which was starting to turn purple, black, blue. After several non-invasive methods, they did what they had to do. They had to inject drugs directly into the head of his penis. Not one shot, not 2, or 3, or 4, 19 injections into the head of his penis. It was still swollen, bruised and red 2 weeks later. I just posted this in another thread, but it fits a little better here. Don't hate me for the double post. I'll remember when I'm down and out that even if I have 99 problems, 1/5 of them aren't penile injections. I am a pre-med hospital volunteer in a South Central Los Angeles, and one night while doing my volunteering, following a physician around, a man came running in and collapsed. The nurse explained to me that this was something known as the homie drop-off. Basically, this guy got his neck slashed with a blade and his friends found him. They drove him to the hospital, dropped him off and bounced. That was the first time I had ever seen so much blood squirting out of a human's throat. I am not sure if he made it or not, but I trust that my hospital's nurses and physicians are experienced enough to save his life. Nonetheless, I still enjoy working in the air. I did not witness this firsthand, but the most disgusting medical related story I've heard from a practitioner who actually lived to tell the tale. As part of my training to be a rape crisis counselor, a doctor came in to give a presentation about STDs and STIs. Somehow he veered off the main topic and starts telling us about the things he's seen in his time. A female patient came in complaining of extreme abdominal pains. The patient disclosed that she was a prostitute. The patient further disclosed that in order to continue working while she was on her period, she would put a sponge as close to her cervix as possible to absorb the blood and other menstrual related discharge. The patient then explained that she had inserted a sponge and was unable to remove it. The doctor figured it would be a routine matter of removing a foreign object that had become lodged or stuck, and takes the patient into an exam room to perform the extraction. When the doctor went to remove the sponge, it turns out that the patient had been using a car washing sponge to absorb her menstrual discharge, and that the same sponge had been in her vagina for 3 months. When the doctor finally managed to remove the car sponge, which had turned into black, semi-solidified mass due to excess absorption of nastiness, it also released a torrent of fluids that had been marinating in this woman's vagina for 3 months, and the fluids gushed out and nearly covered the entire floor of the exam room. The doctor told us that it was the first time in his 20+ years of practice that he actually vomited while performing a medical procedure, and that the stench from that room was so foul and pungent that it filled the entire clinic and made a seasoned nurse, who was standing in the hallway, vomit. As the doctor was retelling this horrifying life tragedy that he survived, he didn't look a single person in the eye. His eyes were transfixed on some non-existent point near the horizon of his traumatized memory. TLDR, doctor pulled out a car wash sponge a prostitute had left in her vagina for 3 months. Oh my god. I was assisting in a crash C-section once. The mother was eclamptic, sky-high blood pressure, and the only cure is to deliver the baby. But she was only 25 weeks. It was so fast that there was no time to get an epidural, so we had to put her under general anesthesia. The baby had a strong and healthy heartbeat, but of course, once you deliver at 25 weeks, that doesn't matter. The father sat in recovery, beside his wife's stretcher, holding their dying baby, the whole time tears and tears just running down his face. He never said anything. He just sat, without talking, holding a tiny bundle of blankets, looking down at a perfectly formed tiny face struggling to breathe. The mother was still sedated, but when I walked in, the father had the bundle in one arm, and was holding the hand of the mother with his other hand. He was humming a lullaby. He just held the baby until he died in his arms, never saying a word, just rocking it back and forth, humming to him, crying the whole time. That's terrible and heartbreaking. I'm in school for cardiorespiratory therapy, and though I know I have to be in pediatrics as part of my course, I hope I don't have to work in a pediatrics unit after that. I just couldn't. Not a medical professional but a victim's advocate that meets victims at the hospital. I walked into the hospital room to talk to the victim, and when she looked up, both her eyes were red, like there were no white in her eyes because she had been choked out so bad. The worst part was that a few years before, her dad got in trouble for molesting her, but she decided not to testify last minute so he didn't go to jail, and I had to sit and wait for the dad to come to the police station, where we had to go after the rape kit, and talk about how much he loved his daughter and gave her this huge hug, and I wanted to throw up. Stories from Doctor Friends. 1. Guy was scratching his hemorrhoids with a 50mm bullet and it got stuck up there. Since it was a live round, the bomb squad was called and held their blast shields or whatever around the patient's butt as it was removed. 2. Couple wanted to make perfect custom dildo for guy's butt, so they put a condom in and filled the condom with cement. Condom breaks and almost a foot of his intestines has to be removed. My mom is a nurse in the ICU. One day, she got an elderly patient that was in terrible condition. The woman's toe was literally rotting off while still attached to her foot, and most of her body was covered in dried crap. In some places, the crap was literally inches thick. She was also half-starved and had bed sores from not moving. The most horrifying part is that this old woman had been living with her own son the entire time. She'd fallen down in their kitchen, and he had just left her there. That is just sickening. Wow. I'm a surgical tech. My worst night at work was when we had a young kid, 16, get shot during a drug deal. He died. We tried so hard, but there wasn't even time to process it, because we had another emergency. It was a guy with Fernie's gangrene, which is basically when your nutsack rots off. We got there just in time for the surgeon to catch it and hand it to me. This is a story which kind of fits into this. I heard of a friend's father who is an EMT. He was an experienced paramedic and seen a lot of gore. One night he was working. He gets a call to a motorcycle accident caused by an elderly driver. The biker was out cold and had essentially scalped himself from the forehead to about halfway across the top of his head. He was actually okay in the end, but a policewoman came over to ask if the biker was okay. The paramedic grabs the scalp and uses it like a ventriloquist doll, saying, "Do I look okay?" The policewoman proceeds to go into shock and start vomiting. I know it's cruel, but I laughed while being disgusted when my friend told me it. I love paramedics. Really puts your sick sense of humor into perspective. In my first year of nursing, I had a patient who was immobile with severe contractures, elbow and knee joints frozen up. He had been constipated and needed assistance. After medicating him earlier in the day, he was finally able to go but needed some assistance. So my CNA, nursing assistant, turned him to the side while I pulled log after log of soft formed stool from his butt. It was like working at a Tootsie Roll factory. My mum works in a hospital, so I've heard enough horror stories. One that sticks out was when a guy was brought into her after being mugged. My mum was supporting his head neck while he was being moved, and when she let go, her gloved hands were covered in his blood and parts of his brain. Apparently the muggers had hit him in the back of the head with a brick. She told me about it when she got home from her shift. I've never seen her look so traumatized. The hospital she works in also treats inmates from the prison nearby. When they come into hospital they're obviously handcuffed to the gurneys, resulting in them being convinced that they're either being killed by lethal injection, despite the fact that the UK doesn't have the death penalty, or being experimented on by the government. Once, for some stupid reason, a prisoner was in a room with only a trainee ODP, operating department practitioner, keeping an eye on them. Said prisoner was heavily sedated but he started to come to, then freaked out and ripped his IV out, resulting in blood being sprayed all over the room. The trainee panicked and ran around the room screaming. My mum and 2 other ODPs ran into the room to restrain the prisoner and throw the hysterical trainee out, all while slipping on the blood that had covered the floor. When my mum told me about the prisoner I was nearly laughing at the comedy skit-esque setting. She said that she's never been so close to slapping a trainee before and telling them to sort their crap out. I worked at a nursing home that was attached to a small hospital. We ended up with a patient that had came through the year after her family finally decided it would be wise to call EMS for her. The family claimed she had fallen down the basement stairs and they couldn't get her up. The EMS workers were certain that she was living in the basement because the floor was covered in feces and urine where she had been laying. When the doctor was standing over her he asked, "Why is her hair moving?" Her hair was moving because she was completely infested with lice. They also found cockroaches in her soiled diaper and her labia. No. I was an EMT for a volunteer rescue squad in the south. A young lady was riding in the bed of a pickup truck but actually sitting on the side of the bed. Well, of course she fell out going around a curve at about 45 miles per hour. She landed on the back of her head. The truck kind of dragged her for a little bit somehow. Anyway, when we got there she was on her back. We did our thing and went to turn her to do our check and the back of her head was like mashed potatoes. Best way to describe it. Needless to say, she didn't make it. I have lived in the country my entire life, and we've always driven pickups. My mom was always terrified of us falling out of the back, so whenever we rode we had to sit up by the cab and hold on to the edge or lay flat on our backs. Childhood, good times. If you are new to the channel, you can subscribe. I publish new videos every day. Until then, check another video. Bye for now.